Turn all my phones off.
Yeah, turn your phones off. It's setting up right now. Looks like it's going live. I'll let you guys know. And that, I'm sure you can hear me. Just help me make sure that this actually works.
It says webinar is now live streaming on Facebook.
Wonderful. Hopefully through Church Health. Yeah. Okay. Okay. So we're going to go ahead and cast this. Okay. Theoretically, attendees can now join. We are recording our webinar and it is going live on Facebook. Participants are joining in right now. They haven't been able to join since until this moment. So I just want to say a big thank you to everybody for joining us today. We are going to wait for a couple more participants to kind of get going. Let's see, I'm going to go ahead and share my slides. Let's see here. Okay, wonderful. So Sharon, Melissa, and Lakeisha, you guys have everything you need, seems like. Okay. Thank you everyone for joining us today for our webinar series. We're very thankful to have so many people who are wanting to learn more about how to make better and different food ministries right now in this time of COVID-19. You're joined today with Church Health and with Lakeisha Edwards of the Mid-South Food Bank. Our Church Health staff is our wonderful Sharon Moore and Melissa Peterson. They're the brains behind our Nutrition Hub. So hopefully in the future, when things go back to normal, please check out our programming in the Nutrition Hub. It's cooking classes and just wonderful things that you can join to make Memphis a healthier place. We are talking today about how congregations can partner with the Mid-South Food Bank and how congregations can take seriously the call to social distancing in their feeding ministries. We will be discussing practicalities. We will be having Q&A answered at the very end. So please, if you have a question, feel free to use our Q&A feature at the bottom of this webinar if you're watching via Zoom. If you are watching via Facebook Live, you will be able to post questions on the Facebook live stream, and we will be working behind the scenes to compile those and go through a detailed Q&A if we have time at the end. You will receive a follow-up email with resources and contact information tomorrow if you've signed up for this webinar via email. So whichever one you registered with, that's how you'll receive it. If you don't receive it tomorrow, please do check your spam folder. Oftentimes it can end up there. And the other housekeeping thing I want to mention is that we have a wonderful Facebook group right now. It's called the Memphis Clergy COVID Response Group. If you'd like to join that, please follow us on Facebook at Church Health Memphis and also churchhealth.org/FCE. All of these links are here on this page right now, and you will be receiving them in your email tomorrow. So please don't worry if you don't get the links down immediately or if you need a little bit more time to figure out what your response is going to be. We really do encourage Q&A, so please feel free to ask if you have any questions. If you want to go ahead and preemptory ask a question, please let us know. We will answer it if it doesn't get answered. We want to go ahead and introduce everybody so we can get this webinar going. We've got Sharon Moore, who will be talking later. We have Lakeisha Edwards with the Mid-South Food Bank and Melissa Peterson. I'm going to stop talking because I'm not the main event. Lakeisha, do you want to go ahead and give a brief introduction to yourself and just jump into your content?
Sure. My name is Lakeisha Edwards. I'm the Director of Agency Partnerships and Programs here at Mid-South Food Bank. Just a little background information, Mid-South Food Bank does service 31 counties within the Mid-South area. That includes Tennessee, Arkansas, and Mississippi. So we want to make sure that people do realize that we're doing the work in more than just Shelby County or the Memphis area. We do need assistance in all of those areas, especially in the more rural areas. Right now, we are doing a heavy concentration on Shelby County, but that doesn't negate the fact that we do need assistance further out in other counties in Tennessee, Arkansas, and Mississippi. We are currently packing 14-day boxes, but that packing will cease very shortly. As of Thursday, and I know there's been some miscommunication, but as of Thursday, we will no longer house volunteers here at our site. It does not mean that we will not do food distributions. I know that I've seen a little bit on social media this morning, people saying that we were closing, that we weren't giving food out, but it's only for the safety of the staff that we do still have here in the building, and also just to decrease the amount of individuals that are grouped together in small places. So we will not be packing those boxes, but we will still have that food available for people to pack on site. Right now, what we're looking for is nonprofit organizations or church entities that are willing to take the food and do our distributions. We are not currently bringing on or fully onboarding organizations as partner agencies. However, we are doing temporary partnerships so that they can actually do the food distributions on their site. So if an organization says, we have our own food program, we just need food for our program, that's a partnership that we would do later on down the line. So they can still print out one of our applications, which is on our website at midsouthfoodbank.org, or they can, of course, contact us directly. I'll have my information, of course, on site and also on the website. We always have our information there, but they can email me atledwards@midsouthfoodbank.org. We can send them the application if they don't have access to the website, or if they even need us to mail it out. They can call at the food bank and either be transferred to me, or again, my direct numbers are on our website. But for the full partnership, what usually happens is we have an organization give us an application. We vet the program by looking at their finances, because we want to see how are they funding the program and see if it's sustainable. Because one of the things that Mid-South Food Bank prides itself in doing is going into communities and being a sustainable resource. So we don't want to do pop-up shops where we come into a community, we provide a resource, and then they never see us again. We also don't do special events. So we don't just show up at Christmas or Thanksgiving, or just because we're doing some type of food drive. We want to make sure that we're doing consistent distributions. Of course, many of those things have been reconsidered during this time with the COVID-19, but we do want to make sure that everyone involved does realize that we're looking for long-term solutions, because we know food insecurity is something that is very consistent, and it's not something that will go away even after this is settled down. So we want to make sure that either the partner agencies are agreeing to be a temporary distribution site, or they want to be with us for the long haul and fill out an application so that we can look at how they can be sustained, talk about how frequently they will distribute, and then also coming out to do an inspection to ensure that they are within the food safety guidelines and that they have the appropriate volunteer staff, that they have the appropriate storage capacity, and just to make sure that they truly understand the mission of Mid-South Food Bank. The way the food distributions are now being handled are if the organization contacts us and says, we want to be a food distribution site, the very next step would be for them to give us a little bit of information about how they're going to recruit volunteers, what type of volunteers, because having children as volunteers or adolescents as volunteers is a lot different than having seniors or having able-bodied adults. So we kind of want to know what type of volunteer base you have. And then we want to know about your actual site, because we actually need enough space for us to be able to come out to that site, to be able to get several hundreds of cars into that site and then out of that site. Another thing with the logistics is to consider a way for people to get in line and also get out of line, because there may be someone who doesn't have ID or some type of proof of address, because many of the sites we're trying to service a particular zip code, or we may need to just simply verify that that person is who they say they are. The reason for that is because many of these distributions, specifically in Tennessee, we are giving out government commodities. So of course, when we're dealing with USDA, we do have to have a mechanism to actually track and to document who actually received the food. After we talk about the logistics and we make sure that that space is large enough and that it can actually house or host this particular mobile distribution, then we talk about what is needed of the volunteers. We need volunteers to bag food in what we call household quantities. So when we bring the food out, we'll bring enough food for the amount of individuals you stated you would serve. So ahead of time, you would tell us if you're servicing 250, 500, 1,000 clients, we can do just about any number as long as you have the facility and also the volunteers to actually do that distribution. We do ask that you start at 250 households. That is pretty much the minimum of what we're looking for, simply because we do have a limited transportation team as well as our fleet. So we want to make sure that we are actually taking it to sites where we can get the most bang for our buck. We also want to look at how many volunteers are going to be at each station. So the way the food distributions are set up for a mobile pantry, each station has 1 to 2 volunteers. Because of social distancing, of course, we want to make sure that we don't have them crowded into small spaces. So you want to make sure that even the way we put the pallets out onto the ground, that we have volunteers on each side of it versus being all together on one side, that everyone has gloves, that no one is getting out of their car in regards to the clients, and that we are taking the paperwork that we need, putting it into an envelope with gloved hands, and also not exchanging pens. That is something that's really hard for us to get our volunteers out of, because they're so used to saying, oh yeah, you can borrow my pen, and then taking it back. But we want to make sure that people are using their own pens, and if you give them a pen, that they keep it. So again, that is our safety precautions during this outbreak, because we want to make sure that there's no real client to server contact. So the food is being placed into their vehicle, either on the back seat or in the trunk. They are only giving their paperwork to an actual volunteer, not their ID or the MLGW bill or whatever they use to show their address. They're only going to show that in the window, so they can hold it up, show whatever proof that they're giving, and then just simply give that eligibility form to the volunteer, who will then, with gloved hands, put it into an envelope. And then we bring that back to the office to actually put that into the system, or have our volunteers to input that data. On the stations, going back to the way that food is packed, we do provide plastic bags so that they can bag the groceries just as if the individuals had went to the grocery store. So we'll say bag this much of the meat, this much of the produce, this much of the cereal. We may have jugs of milk that don't have to be bagged. So we'll have some items that have to be bagged, other items that can be placed directly into the vehicle. Once the vehicle has gone past all of the stations, then they are free to go, and we don't ask that anyone get out of their cars or go back through the line for any other reason. It's usually a pretty smooth process, and we can service anywhere from 200 to 300 in a matter of a few hours, especially if we have the capacity to have more than one line rolling at the same time. But of course, that does mean that you need more volunteers, more tables, more gloves, more supplies. I think that's kind of most of the information.
Awesome, thank you. Lakeisha, do you want to speak a little bit more to next steps if people are interested in contacting you for that?
Yes, so if you decide that you do have a site where we can actually host a food distribution and you're ready to go ahead and schedule, I can be contacted atledwards@midsouthfoodbank.org, or by phone. My cell phone number is 901-485-1700. And when you call, of course, I'm going to ask some of the questions that I went through here on the live, just talking about the facility, how many volunteers, and making sure that it's a full understanding of what it really means to have a food distribution, or a mobile pantry distribution specifically. Also, on our website at midsouthfoodbank.org, there is a coronavirus response link that takes you to all of the food distributions we already have scheduled. One of the things that I do also recommend is that anyone who wants to do a food distribution should actually go to a distribution first, so that they can actually see the setup and see what they're signing up for. I think some of the individuals that have requested the food distributions didn't know exactly what all they were asking for, and it caught them by surprise, but everyone has done an amazing job. We've had so many organizations that have really stepped up in this time of need and supported us. We're hoping that many of them will come on board as full-time partner agencies as soon as everything settles down, but we have been very impressed with individuals doing this for the first time with absolutely no issues.
Wonderful. Thank you for sharing that. So just one more question. Can you give a 30-second recap? It sounds like there's just a ton of information that you just gave, but can you just so who are you looking for, and what are the opportunities that you have? Because I heard a couple different things.
Yes. So number one, it can be any site throughout the city. Right now, we're focusing on Shelby County, but we need them within our 31 county service area. So you can look on our website to see all of the counties that we cover in our service area, but we need them everywhere. Right now, we are focusing more so on Shelby County just because it's easier for us to run the trucks. Secondly, if you are a 501c3 or a nonprofit organization, That is what we do have to have. You don't necessarily have to show a book worth of proof, but we do need to know that you are a nonprofit, that you're working as a nonprofit organization or a church that is under a denomination or independent church. Third, we want to make sure that you understand that you do need tables, supplies, and volunteers. And then, of course, last but not least, just contact me directly so that we can talk through the process and set a date.
Wonderful. And we are going to have time for a Q&A at the end, but while I've got you kind of big talking head on the screen, what is the minimum number of volunteers needed for the 250 households?
We usually ask that you have anywhere from 10 to 15, because keep in mind that you're bagging each of the categories of food, and it takes a really long time when you only have 4 or 5 people. You also need someone that can be out directing traffic, because there's lots of cars, they'll be lined up down the road, and you want to make sure that you have someone that can give out those eligibility forms, pick them up, and then also have other individuals that are bagging the food ahead of time and also while you're distributing, because you want to get a head start on the bagging. So you're going to bag an hour before the truck actually, or before the clients actually come. So the truck will come an hour before your actual distribution time. So that gives you the first hour to set up, to start bagging that food, to kind of get organized. Then once your cars start lining up, then you have volunteers that shift from the front of the house to the back of the house. So they're going to be just bagging behind those volunteers as the frontline staff or volunteers are distributing the food into the vehicle.
Wonderful. And so I'm assuming that that can be done maybe even with 10 or less, just to follow CDC guidelines.
It could.
Okay, it could.
And with those guidelines, that 10 is for, number one, social gatherings. And number two, you can also, especially if you have a large area, put them 10 to an area. So there may be 10 people that are spread out directing traffic, or another 10 that are spread out with the delivery, or another section of the area where you have 5 or 6 people that are actually bagging the product. Because we have talked with the mayor specifically about the need for us to have more than 10 people on our distribution sites, especially considering the sites where we're servicing 500 or more.
Wonderful, thank you. And then I'm going to do one more question. So, and this might be something that people need to individually follow up with you for. So if so, then just please cut me off at that. But what about food pantries? This is coming from Church of the Holy Communion. What about food pantries, walk-in pantries that are already in partnership with Mid-South Food Bank? Is there a process in place to convert that to a drive-through for compliance at this time?
We can do a drive-through at any of those locations as well, but many of our partner agencies are a little smaller than what we would prefer for that type of traffic. However, we are not discouraging any of those partner agencies to close. We do ask that you do keep the traffic inside of the pantry at a minimum, but we have offered the food that we have on our shopping list that we send out to our partner agencies for them to gather the groceries that they need to continue their services. They may have to reconsider how many people they're allowing into their space, but we do want to make sure that they stay open if they can.
Okay, thank you so much. Lakeisha, if you want to kind of hang on, and we'll do a big group Q&A at the end, but I do want to turn it over to Sharon and Melissa, Sharon Moore and Melissa Peterson with our Church Health Nutrition Hub. I'm not sure who wants to start first, but I will have them introduce themselves, and then we'll kind of launch into some of the practicalities around what feeding ministries look like during social distancing. Thank you.
Thanks, Lauren. I'm Sharon Moore. I am the Wellness Education and Nutrition Manager at Church Health. The part that I was going to do is walk through the true and solid good practice information that we're following at Church Health. And then Melissa was going to walk through, okay, so how does that apply then to food ministry? So I'll go ahead, and then Melissa will go after me if that's okay. Well, first of all, I just want to applaud each and every one of you on the call today for your commitment and willingness to help your church family. It truly is amazing to see how many people are reaching out to Church Health and wanting to do something to help those in need. And every one of us, you know, all the panelists, Lauren, the moderator, people behind the scenes, every one of us has that one thing in common. We all have a servant heart. And what we need to do at this time, while we are really feeling that call to be Jesus's hands and feet and continuing to do his work, helping our neighbor and those in need, we also have to, during this COVID crisis, we need to be aware not to let that desire override these guidelines and common sense practices that are out there and recommendations by the Center for Disease Control and our very own local health department. We need to heed that advice. And I'd just like to also acknowledge and put this out there. Yesterday, our founder and executive director, Dr. G. Scott Morris, who is a doctor as well as a Methodist minister, he did a video YouTube for staff yesterday, and now it is on Facebook, and all of you can access it if you'd like. But he walked us all through the data and showed us on these slides exactly what's going to happen if people do not heed the advice of social distancing and these common practices that we've all heard about. If we don't do those things, each of us individually, the crisis is going to be much worse than it needs to be. And one of the things that struck me in his video yesterday was that he said, God wants us to be smart. And I loved that. And I think we all need to heed that, because those of us who have hearts to be servants, sometimes we let our desire to help and do override being smart. And this is the time that we need to really pay attention and do these smart things. So what I'm going to do is I'm going to go through a couple of slides, and these are from the CDC, because I want to be sure you all have the correct information and that you also are aware and heeding to this advice, because these experts at the CDC and the health department, we're in contact with them at Church Health, not me personally, but our senior directors are in contact with these experts every day and giving our staff updates every day. And we're trying to implement those things. And that's what we want to share with you all today, is what we've learned and how we're implementing these things at Church Health. So I'm going to go through a few of these things just to be sure you have the right information. And then Melissa's going to kind of tie that in to food ministry and how we're doing it and how you might do it in your own congregations. So this is my first time on a webinar. I'm going to share a slide, so bear with me. Okay, so this is a slide, and this is actually from the CDC. And the things that I just want to point out to you, and Lauren will send these out later, so you'll get this, but just what exactly is the coronavirus? It's a novel. The coronavirus is novel. We don't know that much about it, but we do know that it is a respiratory illness, and it can be spread from person to person. Therefore, the need for social distancing. What are the severe complications from the virus? Some patients have pneumonia in both of their lungs. It can cause multi-organ failure, and in some cases cause death, which we have all heard. How can we protect ourselves? Some of you probably already know this, but I just want to point this out because even Lakeisha mentioned some of these things about washing hands and social distancing and that sort of thing. But first of all, you want to avoid close contact with people who are sick in any way. You want to avoid them because we don't know for sure what they have. You want to avoid touching your eyes, your nose, and mouth with unwashed hands. You want to wash your hands often with soap and water. You don't have to have, these wipes and the gel and all of that. Just good old soap and water is great. And if you are using an alcohol-based sanitizer, it needs to have at least 60% alcohol. Okay, if you're sick at home, let's say you wake up, you don't feel great. Maybe you have a sore throat. Maybe you got a headache, whatever. Stay home if you think you're sick. If it's something that you don't normally deal with, then take precaution and stay home. If you cough, cover your mouth and put it in your elbow, and cough into your elbow. If you sneeze and you have a tissue, sneeze into that tissue, then throw the tissue away. If you don't have a tissue, then sneeze into your elbow. And then clean and disinfect, quite frequently, all over wherever you're touching, any spaces, your computer screen, your telephone screen, your coffee cup, your tabletop, anywhere that you're working and you're touching over and over again. Disinfect those areas often. And of course, if you've traveled somewhere and you think you've been exposed, then of course you need to possibly quarantine yourself for a couple of weeks. But I want to talk a little bit more specifically about how it spreads. And what we know today, and we don't know a lot about the virus, but what we know is that it's spreading from person to person. It's also thought to spread between people who are in close contact with one another, within 6 feet of each other. So that is the reason why, for the social distancing and saying, please keep at least 6 feet between each other. It is thought to be spread through respiratory droplets. And that's how we can infect each other. If those respiratory droplets touch a surface, or if someone who is infected touches the surface, there is some concern that it can be spread through surfaces as well. But for the most part, it's being spread person to person. And then just lastly, the symptoms. And you can have all of these, or you could only have one of them and still test positive for the COVID-19. Fever, cough, and shortness of breath. If you have any of these, then you need to stay home. You need to quarantine yourself and monitor your symptoms for 14 days. Now I'm going to show a different screen. This one is just a little bit more about transmission, excuse me. The person to person. It's thought, again, to spread person to person between people and through those respiratory droplets. Can someone spread the virus without being sick? We do know now that that is possible. A person could be asymptomatic, but still be sick. They just don't know that they are. Again, if we're 6 feet apart from each other, it's very likely then that even someone infected could infect someone else. So I'm pleading to you to follow the recommendations that have been given to us, and to realize that by not doing these things, we may actually be causing more harm than good. So if we let ourselves get caught up in this and go out there and not follow these guidelines, we could actually, instead of helping our friends and neighbors and church members, we could be causing more harm. So that is really what I want to try to emphasize to all of you today. Now I'm going to turn it over to Melissa, and let Melissa kind of talk about what we've done at Church Health to help integrate these guidelines that we know are helpful.
Thanks, Sharon. Good morning, everybody. We are going to talk a little bit about implementing it specifically with cooking, whether you're cooking for homeless populations, whether you're serving in a food ministry that way, whether you're cooking for your own congregations. There's just some things to take into account to try and make it a little bit safer and easier. The first, we've talked about separation, about creating social distance. And there's two ways you can use, one or both, to do that as you're cooking for people. We've implemented those ourselves at Church Health. One is with distance. You're keeping people 6 feet apart. And sometimes it's hard if you're working in a kitchen. We're used to being elbow to elbow and walking behind people. And Now's the time we need to separate those work areas, whether you have to separate it with distance, and not everybody can do that with a small kitchen, or separate it with time, working in shifts of smaller people. That's one of the things we've been doing at Church Health. We have a meal ministry there for our patients, and we have a very small 400 square foot kitchen that we've been working in. So that means one person at a time is in there. They start early. The production, everything takes just a little bit longer. We're also providing distance with packaging. So things that you may have served straight out of a pot off of a buffet line, with people walking around with plates, we need to distance everything. That means the people we're serving as well, they need to come in smaller groups, and things need to be individually wrapped or packaged in order to be able to be distributed. So a couple more things on safety when you're working with food. Take a look at your crew. If you have people who are over 60 or who have underlying conditions, they probably shouldn't be working in this public environment. Look to some other volunteers and workers. Anybody who's sick, can't reiterate this enough. It doesn't matter if it's suspected to be the COVID virus or if it's something else. You don't want anybody sick. I think sometimes we get caught up and forget that all the other sicknesses that are out there, chronic and otherwise, are still out there. That this is in addition to the normal things we have to deal with. According to the health department and safe practices, if you're working with ready to eat foods, that means anything that's not being cooked, sandwiches, snacks, any of those things, you need to be wearing gloves. And so if you don't have, gloves can be in short supply around here. If you don't have sufficient gloves to do that, you need to not be working with ready to eat foods in order to protect people. We found out the other day when we were trying to look at what we needed to sanitize in our own kitchen, we started really thinking about the things that people touch. And so I invite you to start now by thinking about the things that people are touching in your facility, both in the kitchen, in your parish hall, in the hallways, bathrooms, pepper grinders, salt shakers, sink handles, the little the squeeze things when you're washing dishes. Can't remember the name of it right now, but all those surfaces need to be cleaned and sanitized. The CDC is recommending making up 5 gallons of cool water with 1 cup of household bleach, not concentrated bleach. That is a sufficient sanitizer to use on all surfaces. When you're working in production, if you're, I'm used to talking where you actually get some interaction and if people are working where they're cooking for someone or they're cooking for the homeless. So I'm going to try and hit both areas today. Separate everybody. So as people are coming in for your distribution, we've heard about groups that are doing it in small groups. They're letting in small groups at a time. Communication is key with all this. Even if you go old school, not everybody's going to be able to send out an email, especially if they're serving the homeless. You know what? Nothing wrong with writing on a window or sticking up a big piece of paper that says we're only allowing 5 people in at a time. The biggest thing is to do what you can with what you have now. Lakeisha talked about this, not biting off more than you can chew, because this is a long-term issue and we have a crisis right now, but we need to dig in and be able to grow it over time to fix the problem. So what you have now with food, what you have now with labor, packaging, and your facilities, you're probably not going to be able to build a kitchen next week. So look at your facilities and see, what can we do now? Can we do 1 meal a week? Can we do 2 meals a week? Can we do 1 meal a day? What can we do now and grow it over time so that people who are reliant on this know that they have a place that they can turn? Things are just going to take a little bit longer. If you look at your volunteer shifts and you're used to having 12 people come in at a time, 20 people come in at a time and cook up a storm, you're going to have to break it down and have 2 people do the shopping, 2 people come in and prep and cut vegetables, another 2 people come in, depending on your space, of course, another 2 people come in and cook, and another 2 people package, and then 2 more maybe coming in to distribute. Think through the whole process. And I think one of the things that might make this easier is building a network with other people, other churches around you. Doesn't matter the denomination. We all need some friends and support right now, and being able to call somebody and say, I don't know, how much beans and rice do I need to feed 150 people? Hey, I'm out of salt. Hey, I found a stockpile of paper cups. Can you use some? Having those people to turn to and share things with, share brain power, share volunteer power, share knowledge, share problems is really going to make this a heck of a lot easier. It's really key to not wear people out right now. We got to be able to do this for a little bit of time. Communication. Oh, other people that kind of work into everything is farm your congregation. You've probably got some resources in it that you didn't know about. There's a chef whose restaurant may not be very busy right now, or they might be able to throw some volunteers your way to really be able to push you over a hump or stock you up on some things. They might have some surplus materials that they're not able to use in the restaurant, but you could incorporate into your ministry. You may have some barn burner gardeners in your congregation who are just itching to plant fields and fields of greens, or they're going to have a peach tree come in. We want all that food to go to someone who's going to appreciate it and definitely not go to waste. Gearing up for the long haul is just something that we're going to have to do. And even though this is a lot of these food ministries, the important thing is to get food in people. Don't neglect the healthy part of it. One of the least expensive, easiest meals to do is beans and rice, and it's a really healthy meal. If that's the simple place to start there. But keep things low in sugar, keep things low in starch, serve water, and bump up the fruits and veggies where you can. Keeping people healthy is one of the number one ways, or the healthy diet is one of the number one ways you can keep people healthy all the time, no matter if they have to fight off an infection or a chronic disease. Diet is a big component that goes into that. So do what you can with what you have in order to do that. When you're working on your support network, I did this just the other day. I'm in our kitchen all the time, but I still went back into our dry storage and looked at everything. What do I have to work with? Sometimes if you're shopping, I know congregations that shop at Costco or Sam's Club, Restaurant Depot, any Walmart, any of the other stores where you can get a lot of food if they're shopping and not using one of the food delivery services. Not everything's going to be there. I went in the other day to Restaurant Depot and they had all sorts of things, but they did not have milk. They did not have dried beans. They had one bag of rice left and I got it. And they were low on packaging. So it required some retooling right there in the store. And if you've got someone you can call, someone in your congregation, someone that you work with, another church down the road, to say, hey, what do you think I can do with 25 pounds of lentils? Certainly access that, but know what you've got kind of in your inventory. Be sure and exchange cell phones and have people that you can call on a moment's notice. Have a plan. I've got a bunch of recipes that I work from, but I also have resources that I contact. I hit walls once in a while where I go, I'm not sure what I'm going to do with that. I've got kind of a plan. I have to throw that plan out the window once in a while, but it's just a heck of a lot easier to change gears when you do have some sort of a plan. The plan that says we're going to put out meals on Monday. We're going to have another person come in and put them out on Wednesday. And I've got labels for them. We do packaged meals for our patients. That plan's all in place. And so if something happened and I went down, I got sick, there's somebody else who can pick up the slack. Or if we need to gear up, the plan's already in place. So we're not reinventing the plan, we're speeding up what we already have. Communication is key. Touching base with everybody and letting them know what's happening, including the people that you're serving. Let them know if you're used to doing 3-course meals and you got to drop it down to a really nice soup, let them know why. They understand you're doing what you can with what you have. Take a look at what works and then what doesn't. And gosh, if it doesn't, get rid of it. This is something where everything's going to get speeded up and then drawn out. So if it doesn't work, don't keep trying to fix it. Go with something that works. this is a great time to maximize your efficiencies. I know a lot of people who love the meditativeness of chopping vegetables and everything. Hey, put some tools to work. If you've got a food processor, bring it in and put it to work. There is nothing wrong with taking all the garlic and putting it in a food processor and mincing it all at once. There no shame in that. Do what you can to use less pans. Don't bother frying things. It just makes a mess. It's more to clean up. Bake whenever you can. Roasting is your friend. Because again, you're working with smaller groups of cooks and you don't want to wear them out. So if it's easier to run carrots, slice them through a food processor, lay them out on a tray and roast them, that's a lot less work than someone having to stir over a bunch of carrots for 20, 30 minutes in order to get them cooked. Start simple. Add quantity and variety when you can. This week, our simple was turkey chili. I can do it without thinking, and it used up a lot of the things that we had in stock. I didn't have to go shopping for anything. And so it was just something very, very simple, yet healthy for our patients, healthy and filling. We had suggested, we had some questions before, with this distancing, you may not be able to run people through as often as you had before. So consider doing double servings, something for them to take home. And if it's unknowable whether or not they're going to be able to reheat it, focus on room temperature or cold things, snacky things, whole fruits, carrots and celery sticks, granola bars, muffins, things that are healthy and filling, but that can be taken away and eaten, saved without refrigeration, without heating up again, and can be eaten at a later time, because you may not be able to do 2 meals in a day if you were doing that previously. Communicate. Another thing to communicate is if you're expecting people to take it with them, be sure you let them know that you expect them and that you may or may not have a second meal happening in that day. This is all a big puzzle. What can you do with the budget that you've got, the materials you've got, the containers you've got? That's something to kind of focus on. Containers might be a little bit of an issue for a while. We've got a lot of restaurants who are trying to do takeaway services. And so they are buying up to-go containers and bags. Get a little creative out there and just be willing to look at what you've got and what you can do with film and foil and clamshells and cups, and to be able to make things takeaway and preservable, because it might be a little while before all the supplies are back up to where they were before. Looking at notes here. I'm going to move on to a little bit with distribution. We've covered a lot of it before. With your distribution, you might need to have tables set up outside in order to get that distance where people can pick things up. You might need to kind of pace how often they can come into your facility. If you were used to people coming in to serve them, it might only be a couple at a time. Just communicate it and know that things are going to take a little bit longer. One thing with all the packaging and the making everything to go, don't forget to stock up on trash bags. It's going to make a lot more trash that we might not have been used to before. And last of all, we're going to cover a few little resources for the future. Work on having multiple food sources. The food bank is one. Farmers are one. We still have a farmers market that's up. They're going to be planting and everything right now. Having all your food coming from one source makes it a little bit risky. Check out Restaurant Depot. If you haven't been there, it's a wholesale supplier for restaurants. All you need is a tax exempt certificate. You can apply online and churches can shop there. It's bigger supplies, but not pallets. I mean, you could get a pallet, but when you need 20 pounds of ground beef or you need a 25-pound bag of flour or rice, it's a good resource for that. Gardens are one. As I said before, there are people out there itching to plant gardens because they have a little time on their hands. Find a way to have a network of gardens, or plant it in the front of your church. It's not going to solve everything, but it does give people something that they can do that they're helping. Plot out the network of who has fruit trees and who's going to have fruit this summer. Plot out who has pecan trees. There's a lot of resources and food that goes to waste because it's a beautiful tree that nobody can harvest or takes the time to harvest. Let's find out where all those are so none of that goes to waste. Sharon's a part of a group that does a waste management. They're working to reduce food waste, and it's organized through the food bank and through Project Green Fork. There are organizations that do gleaning here where they go to grocery stores and pick up extra bread. There are resources for that. We're going to try and track those down so that they can be made available for you later. Consider Church Health a resource. Sharon and I are both going to give our emails at the end of this. If you get to a point and you say, gosh, I have 100 pounds of rice, what should I do with it? Give me an email. If I don't have an answer, I'll find an answer for you. If you have something that you need to share with people, you somehow got a hold of a couple cases of apples and you don't have a need for apples right now. Let us work with you and consider Church Health a really good resource to help through this and also any future nutrition needs. Last of all, last comment on this, I think I'd like to encourage everybody to document things. You come up with a good recipe for a really beautiful soup, write it down so somebody else can make it later. You've come up with a really good setup that works really well for your facility, draw a map, make a copy, store it somewhere where everybody can access it. Knowledge helps when we can share it. And so being able to document it a little bit is going to help us be able to share it and either prevent this from happening again or being able to turn on a dime and accommodate and feed people when something like this does happen again. That's all I've got.
Thank you so much, Melissa. So Melissa and Sharon, I want to go ahead and just do a quick recap to make sure I caught everything. So it sounds like, first of all, Sharon, thank you for sharing the CDC recommendations. First of all, we have to convince people to take this seriously. Once that is gone. Second of all, Melissa, it also sounds like people should, if they have not already, take stock of what they have. Doing an inventory list of not only what you've got in your pantry, but what you've got in your congregation is always a great idea. As particularly someone like myself who also works in the hospitality industry, there are many a hospitality worker who are job insecure right now, which means they have time on their hands and probably want to funnel that into the greater good if they belong to your congregation. Melissa said, if you have a lady who loves to chop carrots and wants to use a food processor, let's do that. If your congregation does not have a food processor, please feel free to put out the call. It sounds like networking and even gleaning are going to be huge in the upcoming months. So if you're a congregation in Cooper Young and you don't know what's around you, make a list of community centers, other congregations, reach out to congregations in your network, see what people have. Maybe a congregation, there's no way they could do social distancing in their small kitchen, but they have willing volunteers who want to come help yours. Let's see what else. Melissa, you mentioned Restaurant Depot. I think that's a wonderful one. Sharon and Lakeisha, do y'all have any other local resources for finding food or for networks that are doing what we're doing right now besides Church Health that you would like to add to that?
Well, there are some food pantries out there, and we can share a list of pantries that are operating. I can certainly pull that together, and some are larger than others. There's also through, and Lakeisha, you can speak to this more, but through Clean Memphis, they worked, my understanding is worked with the food bank, and there's now a Meal Connect app that people can find a meal, and then there's a way for them to receive that. Can you speak a little bit more to that, Lakeisha, since you're doing that there at the food bank?
The Meal Connect map doesn't necessarily send them to meals. If anyone's concerned about actually receiving food, they need to contact us directly, or they can go to our website and put in their zip code, and it'll tell you any pantry that we have in that area. With Meal Connect, we're doing more so with picking up ready to eat foods and then working with our partner agencies to have that food distributed.
Okay. And is there a list on your website of where the food is distributed?
Yes. So if
Okay.
you put in your zip code, it'll show you the listing of any agencies or pantries that are actually distributing
Okay,
within a 20-mile radius.
great.
And
And then
Lakeisha,
again, they can contact the food bank directly because we may have heard of additional distributions that we haven't had time to post, or it may
Put on the
we have
website.
more detailed information. We also have on our website all of the mobile pantry distributions listed out with the actual address, the time that it's going to be distributed, and then if it's specifically for SCS families, because we do have some distributions that are a little more child friendly than others. So those have more cereal and dairy products than some of the regular pantries.
wonderful. I also just got a question in, this might be for Lakeisha. The question is, what number do people call to reach the food bank? People who are in need, but maybe aren't in the system yet. Those who don't have access to internet, I guess.
Yes, because we can look it up for them. So if they don't have access to internet, they can contact us at 901-527-0841.
Can you repeat that one more time for us?
901-527-0841.
And also I'd like to, and this might be for all three of you as well, but maybe mostly Lakeisha actually, is there a way, since Melissa mentioned this, Sharon mentioned this, so many restaurants and places are they're gonna lose their ability to distribute food, but still have stores of it in their pantry. Does Mid-South Food Bank accept donations? What does that look like? If Mid-South Food Bank does not accept donations, do y'all have an idea of where smaller congregations who might be closing their feeding ministries can donate their supplies?
Both. So we accept donations and we also redirect them so that our partner agencies can pick them up directly. So Angela Johnson is over our retail donations program. She's of retail donations. So she can be the one to kind of give that information in regards to where they can actually take the food, or if we need to have an agency come pick it up. But again, they can call our front desk at 901-527-0841. And then there is an option for if they want to talk to someone regarding donations. But yes, we do take donations. We are actually looking for fresh produce or frozen meats or any type of donations like that we can take out on our mobile pantries, because the mobile pantries give families full groceries. So we're giving out the bakery, we're giving out the produce. We try to bring some type of grain or cereal or dairy products. We don't have a whole lot of canned goods right now, but we are receiving additional funds. So we're hoping to be able to order more soon.
Hey, wonderful, thank you. Sharon, Melissa, it's kind of getting towards the end. Do you have any more notes to add, any kind of last minute resources you'd like to talk about? I think we don't have any more live questions to answer currently.
I mean, I would just like everyone to know that we are a resource for helping them find the resources, helping them create recipes, anything we can do. We have so much at our disposal there in the Nutrition Hub that we're happy to assist. And if we can't get the answer or support that, then we can help you find that resource. So, use our numbers, use our email, and reach out to us, and we'll do what we can.
I second what she said.
I love it. So Church Health just thanks you, Lakeisha. Thank you for taking time today to come talk to us and our congregations and our fellow Memphians. Just so everyone's aware, one more time, you will be getting an email with this tomorrow, all of the resources that we have talked about. The four of us are going to take a second to kind of get those resources together. So give us a minute on that. But just going to go over the email addresses one more time, which will be sent out. It'sledwards@midsouthfoodbank.org for Lakeisha. Right. It is more, MOORES, more S at churchhealth.org for Sharon. And Melissa is Peterson M, so PETERSEN, all E's, M at churchhealth.org. Please join us for future webinars. If you have registered for this one, you will be in the loop to receive announcements for upcoming webinars. We are going to be continuing to partner with local outreach organizations and church health subject area experts to try and equip congregations in this unprecedented time of pandemic. So if you have any other follow-up questions, please feel free to respond to Church Health via our website, our Facebook group, or contact any of us with questions and concerns, and we'll try to address them as they come by. Thank you guys so much. I just want to say, I think we're good, and everyone be on the lookout for your follow-up email if you're curious. And thank you to everyone who's called in. One last thing, we're trying to feed Memphis. So keep up the good work. We're all going to figure this out, and we might just have to be really flexible.
Thank you.
Thank you guys. Bye.
Thanks.
Bye.